Catsters, it's Dr. Karyn here, and I've got Clutch with me today as well, who's very excited to be here. But to be fair, I think his excitement is more to do with the chicken I've got in the drawer below me. Now, before I give in to his demands and actually give him some of this chicken, I would like to tell you a little bit about Clutch. Now, I know a lot of you have already met him, and we know that he loves being cleaned with a vacuum cleaner, and he's quite the dude. He's very confident. He does identify his dog a lot of the time and prefers the company of them to the other cats. What you might not know about Clutch is that he's hardly got any teeth left. About 4 or 5 years ago, we realised that the tiny little cute gap that he had at the front of his mouth was actually causing his gums to become inflamed and soften, and a lot of his teeth had actually become quite loose. And it was really hard to see because Clutch is always such a positive, happy, chilled out cat, and he just seemed sad. He was still eating, but just not with as much enthusiasm, and we could tell something was wrong. So I had a look in his mouth, and that's when I realised that this was the problem. And unfortunately, it meant that I had to remove a lot of his teeth. And that includes all 4 of his canine teeth, and those are the big sharp fangs at the front. Now, this is something that as a vet I've done plenty of times to plenty of patients, and I always tell the cat owners that they will be fine. They will recover really well, and in fact, once you've removed teeth that are painful, you'll actually find they'll eat a whole lot better than they were before we actually removed any teeth. Now, I know all this. I tell people this all the time. But when it suddenly was about my cat, I was a mess. I suddenly stopped being Dr. Karyn the vet, and I was Karyn, Clutch's parent. And I was just inconsolable. I was worried about all of the things that you probably worry about if your pet's going in for a procedure. I was worried about how he would do under the anaesthetic. Could things go wrong? Could there be more going on than just the tooth problem? Would he be able to eat once he'd come home? All of those things that are totally normal and natural to worry about. Even as a vet, I was worried about them too. Even though I knew he would be okay, and obviously he was. So fortunately for us, the extractions went beautifully. He woke up and was demanding food that evening. Now, what was interesting is that he'd always eaten fairly well. He'd always loved a bit of chicken, but after his gums healed, which took about a week, he was tearing into pieces of chicken like he'd never done before. Now, obviously, cats need teeth, but he was managing even better without them. So it goes to show you that if your cat is having an issue with their teeth, removing them sometimes is the only way forward, and they definitely will do okay once they're gone, because those gums actually heal up and become quite hard, just like the bone underneath them. And in Clutch's case, he actually uses them as well as he would use teeth, which I'll show you in just a moment. Now, we know that Clutch is quite agreeable and amenable to all sorts of things that I do, but he doesn't love it when I look in his mouth. So I'm going to try a little bit of tempting first, get him on side, and then I'm going to try and show you guys how to check your cat's teeth and mouth at home. Now, if Clutch doesn't play ball, fortunately, I've got 4 others we can try, and I'll make sure that we do show you how to do that. So, Clutch knows exactly what this is, as you can see. Now, most of my cats will only eat some chicken if it's like this. And obviously Clutch is fine with that too. But here is the interesting thing. Look at that go. He makes short work of a pretty decent sized bit of chicken. No hesitation, no problems. He's just munching away. Now, I'm going to interrupt you. Now Actually, I'm not. Right, we're going to let him finish that piece of chicken. I mean, can you believe he's doing that with about 3 teeth? He's still got some of the bigger molars at the back, so he can chew food with some teeth, and he does still enjoy some dry biscuits as well. But yeah, less than a minute and that whole piece of chicken is gone. Now, he knows that there's more, so I'm going to see if he might cooperate with us. Now, if you are wanting to check your cat's teeth, it's often easier to have a friend who can sort of stop them from doing the reversing that Clutch is trying to do. What I tend to do is I don't wrap them up. I find that stresses them out even more. Excuse me, sir. Wait for your turn. I try to use one hand sort of underneath the chin, and I use, pardon me, but my middle finger and my thumb either side of the jaw. Yeah. Excuse me. So, I sort of have one hand under here. I'm trying to push his bottom into my back so he can't disappear. And I'm going to take that middle finger and thumb, either side. You've still got chicken in your mouth, haven't you? Either side of his jaw here. He's not going to cooperate. That's okay. I'm going to bring us in another volunteer very shortly. But in the meantime, so I've got Cyril to volunteer for this particular part of the demonstration, and the other thing I've done, which I forgot to do with Clutch, is I've put a blanket down, and that just makes the surface a little bit less slippery, so they feel a bit more secure as well. Now, no cats really love having their mouths examined. It's not something natural for them, it feels strange, but it shouldn't be painful. And if they do seem like they're in pain, like they're crying out or really, really fighting hard, then it's probably worth getting them into the vet so that they can have a look in case there's a problem. Sometimes teeth can look okay at just a glance, but cats can actually develop these lesions on their teeth and gums that can be quite painful and can really affect their eating and really make them uncomfortable and miserable. So if you are a bit worried there could be something going on with their mouths, it's definitely worth checking out with your vet. So back to what I was saying earlier, I'm going to take that middle finger and my thumb. Now I put that either side at the back of the jaw there, and it just gives me a bit of control over his head without having to hold too tightly. Initially, I'm just going to check either side by lifting up the lips so I can have a look at the teeth on the outside. And then I very carefully take my finger from the underhand and just put it between his lower canine teeth. If I tilt his head back while I'm doing that, he doesn't have as much strength in his jaw, and it should allow me to just hinge that jaw open. And that allows me to have a really good look inside his mouth. I can usually have a little bit of a peek under his tongue as well. Hopefully, he will continue to be almost as relaxed as he is right now. So, hello Cyril, my friend. So I'm giving him lots of pats, just sort of starting with some strokes on his head. And then I move that thumb and that middle finger to his jaw, and I tilt backwards. Meanwhile, I've just got his bottom in my elbow. So this way I can have a bit of a look at the teeth, the outside surface. I can pull that lip back. He's got a little bit of tartar just starting up there, so I'll have to keep an eye on that. Now, I'm just sort of stroking, keeping him happy, and then I'm going to go back to that grip. I'm very carefully putting my index finger between his lower canines, and that allows me to have a look. Good boy. Now, the other funny thing you'll notice with Cyril compared to Clutch is, now he loves a bit of chicken, but if I were to offer him a big piece like this, no Clutch, no, he doesn't know what to do with it. You can have a little bit more Clutch. Cyril will really only eat it if I shred it into small pieces. And as we saw, apart from a little bit of tartar, he's got a mouthful of perfectly healthy teeth. So it goes to show you that if your cat were in a situation where they needed to have teeth out, it's scary, it's horrible, I know, I've been there, but you can rest assured that once they heal up, they'll do just fine.